Hello to Dr. Norizan. I am HAUII and I will kickstart this video presentation. On March 11, 2020, the World Health Organization declared the novel coronavirus outbreak a global pandemic. At the time of writing, the number of cases has exceeded 4.63 million, amounting up to 311,000 deaths. This project is a case study of South Korea's innovative use of technologies during the COVID-19 pandemic. South Korea has been recognized worldwide as one of the most successful countries in battling the pandemic due to their simple yet effective approach, using technologies to decrease human contact and increase tests among its people. The objective of pursuing this direction is to examine the South Korean initiatives for containing the spread of the virus, as well as how we may apply the technologies to our country to better control and possibly eradicate the sickness from our country.
Good afternoon, Dr. Norizan. I'm Yasin. Now I'm going to present the first part of literature review, which is about the different types of IR 4.0 technology available. The outbreak of coronavirus has affected millions and millions of lives. Many developed countries are trying to use the concept of IR 4.0 to implement the latest technology to lower down the effect of this issue. The types of IR 4.0 technology available in South Korea includes drones, smartphone app with location detection technology, and also a drive-thru system. Based on the journal article that we searched from online database, we found that drones are one of the IR 4.0 technology. With the use of drones, aerial surveillance can be carried out safely and disinfectant can be sprayed all over the cities. Next, the implementation of smartphone app and location detection technology also bring a significant effect in controlling the issue of coronavirus. South Korea used this technology to track the location of infected patients. Through the smartphone app, all foreigners need to report their health status, which help to keep track of their conditions. In addition, from the journal article, we also found that introducing the drive-thru system also implements the IR 4.0 concept. People can get treatment through the car windows, which lower down the risk of human contact. At South Korea, the walking-through system was also established for COVID-19 examination. The medical team will examine the symptoms via interphone and collect the specimens. With the big data analytics, the health status of patients can help to detect the spreading of disease and generate new insight of the mechanism. As a result, the usage of IR 4.0 technology improved the efficiency in overcoming the outbreak of the coronavirus. That's all from my part. Thank you.
Good afternoon to Dr. Norizan. My name is THENG and now I'm going to present a literature review to discuss the organization that we want to study. To investigate how IR 4.0 technologies can be used by an organization to adapt to a pandemic environment, our team had chosen the government of South Korea to study on. South Korea was located just beside China and had been strongly affected by COVID-19. According to Dudu, on 2 April 2020, South Korea is declared among the top 10 countries with coronavirus cases. The government officials acted early and managed to control the cases of COVID-19. Unlike most of the countries which had implemented lockdown, South Korea had combined many approaches such as extensive COVID-19 screening, the transparent provision of information, and the use of information technology to control the transmission of the virus. According to the paper by Lee and Lee, testing and tracking is the main pillar used by South Korea to curb the spread of COVID. According to her, most of the strategies were used during the Middle East respiratory syndrome outbreak. This depicts the significance of governments and organizations, rapid adaptation of current technologies, and how one can learn from experimentation and past experience to respond to unpredictable crises. The main methodology used for the project is gathering and analysis of existing data. Online databases and websites are served. So that's all from me. Thank you.
A very good afternoon to Dr. Norizan. I'm Chua, Xian. I'll be presenting the first part for our findings, which include the impact of COVID-19 to South Korea, as well as the applications of IR 4.0 technologies by the South Korean government to fight COVID-19. So the areas of impact we are looking here include economy, labor market, and society. So right now, let's take a look at economy. As mentioned in the report by the Korea Development Institute, which is Seoul's leading economic think tank, the Korean economy is fast contracting as consumption and exports decrease as the negative impacts of COVID-19. For example, exports in April plummeted 24.3%, down to 6.9 billion from April 2019, for a trade deficit of 950 million after more than 80 years of non-stop surpluses. Besides, the IMF organization, which stands for International Monetary Fund, has also predicted that the South Korean economy will shrink 1.2% in 2020. Right now, let's take a look at the labor market. So the South Korean labor market conditions deteriorate in March as the number of newly confirmed COVID-19 cases started to accelerate in late February. The unemployment rate climbed by 0.5 percentage point to 3.5%. The number of employed dropped by 2.5% and the number of unemployed increased by 14%. The number of initial applications for unemployment benefits in March jumped by 24.8% year over year. Right now, let's take a look at the social impact. So the new coronavirus outbreak has led to drastic changes in South Korea's workplace culture, even though it's just temporarily. Many major companies are letting their employees to work from home or have flexible working hours. Ordering food online has also become the new norm, as South Korea has seen an increase of over 90% in online food product transactions during this period. This is because consumers are refrained from going out as a result of social distancing amid the outbreak of the coronavirus. South Korea is one of the only countries in the world that has brought a major COVID-19 outbreak under control. It's not currently enforcing stay-home orders, and most businesses are opened. So the country has actually controlled COVID-19 by rapidly scaling up testing, as well as relying on a series of IR 4.0 technologies. So right now, let's take a look at the applications. So the first one is a mandatory government-run smartphone app that tracks the location of quarantined citizens. The app is developed by the Ministry of the Interior and Safety, and it allows those who have been ordered not to leave home to stay in contact with case workers and report on their progress. It will also use GPS to keep track of their location to make sure they are not breaking their quarantine. Officials say that it's intended to help manage the increasing case load and prevent cases of super spreaders who have been blamed for significant numbers of infection. Second application of IR 4.0 technologies is the location tracking wristbands for people who violate quarantine orders. So after the government, after receiving reports of people tricking the government-mandated app by leaving their smartphones at home, the Korean government actually decided to roll out location tracking wristbands for people who break quarantine. The wristband will connect to the government's mobile app to monitor the movement of a person under quarantine. A notification will also be sent to the authorities if the device is damaged. The third one revolves around big data, and here it's called Smart City Database. So the database is operated by the Korea Centers for Disease Control and Prevention, in short KCDC, and it gives epidemiological investigators real-time data feeds on patients, including their whereabouts, time spent at specific locations, CCTV footage, and credit card transactions. So using this smart city data bank combined with artificial intelligence, it could cut the time needed to trace a patient's movement from about 1 day to around 10 minutes only. Drone deployment for disinfection purposes. So in South Korea, drones have been utilized to spray disinfectant over large public areas in a further attempt to flatten the curve of the virus spread. The fifth one, test kits development and diagnostics with AI. So the design of test kits was developed with the use of artificial intelligence in South Korea. AI helped to shorten the period needed to design and build test kits. The genetic makeup of the virus usually takes 2 to 3 months, and a company in South Korea called Xian actually managed to develop tests in less than 3 weeks, thanks to automation and AI. Artificial intelligence-based big data solutions enable scientists to understand the genetic makeup of coronavirus rapidly. Moreover, AI is also allowing the health personnel to screen accurately and speedily diagnose patients. The main application of AI is on large-scale chest X-ray data to identify symptoms of coronavirus in a couple of seconds and address patients in the critical state. Lastly, we have the information sharing apps in South Korea. So there were many of them developed within a couple of days. The main objective is to inform the public about the coronavirus from different perspectives, such as symptoms, place with available face masks, closest place to be tested, etc. There are also AI-powered applications developed using chatbots to call people who need medical attention. That's all from me for the first part. Thank you very much.
A very good afternoon to Dr. Norizan. I'm EUNICE. I'll be introducing on the application of IR 4.0 technologies used by Malaysian government during COVID-19 pandemic, which are these 3 amazing apps. Gerak Malaysia is an app that helps the police and MOH in tracing and analyzing users' movement nationwide. This app is used to handle interstate travel permission. A QR code will be generated once the user register and apply for interstate travel and to be scanned by police roadblocks. Next, My Sejahtera app. This is a one-stop app to get the latest information and statistics on the pandemic. This app allows users to perform health self-assessment on themselves, inform users of what action needs to be taken if infected, and MOH has access to your data on the app, which allows it to take action if a possible infection has been identified. The third app is My Trace app. This app uses Bluetooth to measure how long a user's phone has been in proximity with other My Trace users. It helps health authority to manage the COVID-19 outbreaks, adopts a community-driven approach, and if a user is diagnosed with COVID-19, this would allow the authorities to track and contact those who might have contracted it from them. Besides these three apps, AI-based system is also used to advance the adoption of analytics and artificial intelligence in clinical and healthcare research on COVID-19 in Malaysia. With the platform, there will be an ability to use the power of AI to support precision diagnosis, early intervention, and greater medical efficiency. It will also help the medical staff conducting clinical research to provide useful information and understanding on COVID-19 in Malaysia. Seeing that Korea is the fastest way to control this pandemic, what are the lessons Malaysia government should learn? Well, first of all is the early and mass testing. This has led to early detection and self-isolation to prevent infection. Drive-through testing and walk-through testing units were also introduced nationwide. Malaysia should really work collaboratively with local 3D printing companies to help produce medical equipment. Next is effective contact tracing. When the person tests positive, all paths are traced to track where and when the patient visited. Besides that, location tracking wristbands can also be practiced by our government to better track the location of quarantined citizens. Lastly is the learning from the past. South Korean government and public learn from their lessons from MERS and make a quicker response to this pandemic. Their current administration also invested more funds in the health sector compared to prior administration. Government and the public has worked together in containing the disease to prevent a repeat of the MERS crisis. Malaysian government should definitely learn from this COVID-19 pandemic and realize the importance of a highly responsive healthcare system. As we all know, a country which is well prepared all the time will be able to minimize the impact of unexpected situations to the country.
Hello Doctor, I'm HAUII and I'll be talking about the conclusion. South Korea is a great example of how AI and big data should be applied for social good, reducing reaction time, increasing accuracy, and deploying solutions throughout the whole country. Many things need to be addressed, such as privacy, data security, and information sharing. Thanks to the country's transparent and consistent government, culture, collective effort, technological maturity, and eagerness to innovate, South Korea managed to overcome the potential risks when facing these challenges. On a positive note, current initiatives taken to limit the spread of the virus have been proven to be effective, with Malaysia being applauded by several notable international organizations. But to beg the question of whether we would prevail over similar diseases in the future is to take further precaution measures in order to respond instantaneously in the event of another outbreak. Our references contain major news sites, journal articles, newspapers, and more. Thank you.